Started in a couple minutes. I'll walk up here. I'll stay in here. Good morning, everyone, and welcome. I am Joe Ruffalo, GM of The Hill. Thank you all for joining us in person today, and for those of you joining us online for our event today, Boosting the Status Quo, Vaccinating America's Most Vulnerable. I'd like to thank our sponsor, American Society of Consultant Pharmacists, or ASCP, with support from Pfizer for their support of this very important discussion this morning. During the pandemic, pharmacists provided more COVID-19 vaccine doses than any other healthcare professionals and took the responsibility of administering vaccinations to older adults, in long-term care settings. Now that the public health emergency is over, a bipartisan bill known as the Equitable Community Access to Pharmacist Services Act, or ECAPS, would establish a federal Medicare reimbursement mechanism for pharmacists to provide testing, treatment, and vaccinations for specific infectious diseases such as COVID, flu, RSV, and strep throat. This morning, we hope to answer such questions as, what are the merits and challenges of the ECAPS bill? What are the latest vaccine recommendations for older adults this cold and flu season? And how can Washington address the challenges of patient access and the broader long-term care pharmacy market? Before we get underway, a few housekeeping rules. If you're here in the room, please silence your phones, but we ask you to join us online. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag TheHillHealth. And with that, I'm delighted to introduce our first guest, Congressman Larry Bucshon from my home state of Indiana, co-sponsor of the Equitable Community Access to Pharmacist Services Act and vice chair of the Energy and Commerce Health Subcommittee. He joins our very own Bob Cusack, editor-in-chief of The Hill. Thank you.
Well, thank you, Joe, and thanks for everyone who came and who's watching. I want to get to first news of the day. Obviously, another troubling event over the weekend. Yeah. Second assassination attempt of Donald Trump. Where are we as a society? And where, I know you're retiring. You were elected in 2010. But what is the state of politics, and what does it show you about what's going on right now?
Well, we need to turn down the rhetoric on both sides of the aisle. I mean, the reality is that we're divided as a country, but not as divided as you might think. I talk to people every day across the country because I talk to members from all over the country, and they tell me, on both sides of the aisle, they tell me what's happening in their area. We're not as divided as you might think, but we have a lot of divisive rhetoric on both sides. And I think, if you look back, the first Congress came in 1789, so we've done this, right? And we've gone through our history where we've had times that have been pretty tense like this. And I think, you look at 1969, you look at the Vietnam War, you look at things like that. So I think we're not in a good place, but I think every American wants us to get to a good place and tone down. I was telling somebody the other day, when I was in college, I don't remember asking any of my friends what their politics was. I just didn't know because I didn't care. And they're still my friends today. Some of them are on the other side of the aisle than me. Mm-hmm. Some of them agree with me. Some of them don't. I've lost a few. I've gained a few once you get in politics. So, that's what it is. We've got to tone it down.
Okay, speaking of which, another just quick one. Do you think we'll avoid a shutdown at the end of this month?
Yes.
Okay.
It's nobody's best interest. This is my 14th year in Congress. I've been through the 18-day shutdown. I've been through a few others. I think we'll avoid a shutdown. I think people on both sides don't want that to happen.
Okay, we're here to discuss vaccines, particularly for those people over 65. You're passionate about vaccines.
I am.
Obviously, this nation has gone through a lot with COVID. Talk about polarizing times. Where do you think we are going forward on vaccines and educating the public?
Well, I think we're getting back to a more normal time. I think, you know, with COVID, it was just such a big disruption worldwide, and there was a scramble to get a vaccine to stop it. And unfortunately, that scramble happened during an election year in America. And if you look back at what people like myself, people on both sides of the aisle, doctors did in Congress, we were doing public service announcements telling people they needed to get vaccinated. On my side of the aisle, I had people pushing back, even in my district, on that. But I said, I'm a doctor, you need to get vaccinated. So I think we're getting back to a new normal. The biggest thing I'm concerned about is this has spilled over into childhood vaccination. And it shouldn't. I mean, this has been established medical care for most people for decades. When I went to medical school, my first patient, true story, first rotation, pediatrics, my first patient, I went to medical school in Chicago. It was at University of Illinois Hospital. She had Bordetella pertussis, or whooping cough. She was an African immigrant, young girl, 8 years old. I've never forgotten that. That was my very first patient. Ajibika was her name. I never forget it. And so that's my main concern. We need to get back to a normal place where we understand that vaccination has really changed the world. And access to vaccination is really critically important, both for children and for seniors. That said, look, with social media, the one person or the two people that might have a reaction, and there are those people, a bad reaction, even fatal reactions to vaccination, everybody knows about it today because it's on social media and it's on the 24-hour news cycle, rightfully so. But we need to get people to understand that medicine's not exact science, and there's statistically, you're in better shape to get yourself vaccinated.
When you say you got pushback, and I'm sure you did, what was the most convincing argument other than that you've been a physician and you know it, which is true,
yeah.
But for others, for educators, because there are a lot of people who, you know, they're not involved in the health day to day, or they're not government insiders, and they don't know what to believe.
Well, it's a scary proposition, right? I mean, you have a pandemic, you have an unknown virus. No one knows what the short or long-term effects of this virus may turn out to be. And you're being told, after it normally takes 5-10 years to develop a vaccine, that you need to get this vaccination that we developed in the last 9 months. Well, that was not totally true, right? Because the technology, the mRNA technology, had been investigated for many, many, many years. We just had to get a DNA sequence and plug it into something that we had already studied and already established. But that's one leap that was difficult for non-medical people to get.
Sure.
And then politicians got in the way on both sides of the aisle. We had, I think, a lot of misinformation out there, again, in an election year, and that's hard to overcome. Let me tell you, as a political person, it is almost impossible to overcome social media because people believe it more than they believe their elected officials or more importantly, their established organizations like the CDC or the FDA or the federal government as a whole. So that's kind of what happened. And as it turns out, I think this will go down as one of the biggest medical successes in human history. A vaccination for a worldwide pandemic in really about a year with, again, many years of research to establish the technique that it was plugged into. I really believe it's going to go down in history as a massive human accomplishment.
Bipartisanship still exists here and there. You've sponsored bipartisan legislation called, as Joe mentioned, the Equitable Community Access to Pharmacist Services Act. Can you tell us a little bit about the bill, And as I mentioned, members on both sides of the aisle have sponsored it.
Yeah.
What it would do and why you think we need it.
Well, for me, healthcare is a couple of things. Number one, it's access. It doesn't do you any good if you can't to have available healthcare if you don't have access to it. And if you look at the number of American people who live relatively close to a pharmacist, and if you look at polling, about 70% of people in the country in some time over the course of a year will interact with a pharmacist or a pharmacy. So that's where this came from. It came from in the pandemic. How do we get access quickly to vaccination? And if you just look at the data, how do you make that happen? Well, rural America, underserved urban America, places like that might not be able to have access necessarily unless they have their community pharmacy or their chain pharmacy like a CVS or a Walgreens close, which almost all of us do. That's where it came from. For me, it's about access, and that's why I started working on this.
And as far as it would set up a new reimbursement system for pharmacists, and it's Washington, so this is a town of push and pull.
Yeah.
The American Medical Association is not a fan of this legislation.
No.
They see scope creep, and they say risky to patient care. What do you say in response to that?
I would say that's not true, because if you look at the legislation, one of the things it says is that whatever happens, it's state by state. Now, scope of practice is generally regulated, for the most part, at the state level. So the legislation accounts for that. It says this legislation allows for direct Medicare Part B reimbursement if the scope of practice in the state, in your state, allows it. That's number one. So I don't see it as a scope of practice issue. I really don't, because we're not saying, well, sorry, state X, you have to do this, even though it may be. And the other thing is there has to be a more specific reason, like a national an emergency declared, like at the state level or at the federal level. So I just don't see it as a scope of practice issue. I see it as an access issue.
You mentioned rural America and access to care. A lot of people in Washington and the Acela corridor, they don't understand the challenges of rural America. You grew up in rural America.
I did.
Talk about healthcare in rural America and how this legislation would fit into that.
Well, when I was a kid, many moons ago, we actually I grew up in a town of 1,500 people in central Illinois. My dad was a coal miner. I had a pediatrician who came to Kincaid, Illinois once a week. You could actually see the physician locally. And then, times change, I get that. You could also go and buy clothing at a clothing store in Kincaid, Illinois back then, right? But as times changed and things became more decentralized, that happened to healthcare also. So you started to see a situation where the physicians were further and further away from areas like rural America, and in fairness, some areas of underserved urban America. And so that's what's happened partially. At that time, it it became more and more difficult to practice in rural areas. And then in most recent history, the reimbursement issues related to how primary care doctors particularly, that includes pediatricians, family practice, internal medicine, OB-GYN physicians, the reimbursement from the federal programs has contracted based on lack of inflationary adjustments. And so it's almost impossible to practice in a small rural town when you may see 4 or 5 patients, when you need to practice somewhere where you can see 60 patients in a day just because of the volume. And that's kind of what's happened. And so, and then one more thing I want to say on that. And then you add on the fact that the cost of becoming a physician, a nurse practitioner, has skyrocketed in the last really 30 years to where you're looking at coming out into practice and you have a lot of educational debt. And so you really can't afford to do it. And again, that is rural America, where I grew up and where I represent, but also in many areas of underserved urban America have the same problem for a variety of reasons, because the payer mix in some of those areas is, mostly Medicaid, some Medicare, and the commercial insurance penetrance in some areas of rural and underserved urban America is very low. so it makes it difficult.
Going back to the ECAPS legislation, what is the path to passage? Obviously, this month is all about government funding, getting that done, but the lame duck could be quite busy. Is that where you're seeing potentially it happen?
Yeah, I'm hopeful to try to get this attached to a healthcare package. I think there's going to be something in healthcare before the end of the year. You know, we need to do things with telehealth, extend the telehealth. We need to do things with our programs that are helping people with substance abuse and mental health issues. There's a number of other in the weeds kind of legislation that needs to, I think, probably get through the Congress in the lame duck.
Do you think that's added to the?
Yeah, I mean, that would
are
be,
vehicles?
I mean, that would be the hope. Honestly, I think that this legislation has caused a pretty substantial discussion on Capitol Hill, and if it doesn't get through Congress this time, I'm hopeful that even though I won't be here, I'm leaving Congress, that it will get picked up, and sometime in the next couple of years, we'll get this through. So, am I optimistic? Cautiously, but honestly, there's going to be a lot of things that are in the healthcare space, I think, that people are going to be talking about. Some will get through, some won't. I'm working on, let me say this, I'm working on prior authorization, for example. I want to get that in. The prior authorization in Medicare Advantage legislation has a couple, 300 maybe, co-sponsors, bipartisan, bicameral, House and Senate. That's the type of thing that I think will get through as part of a healthcare package. I'm hopeful for that, but this we'll see.
So you think there could be a substantial healthcare, and you mentioned about a handful of issues right there that could all be lumped in.
I think
and
so,
passed.
potentially.
Okay. Wow.
You'll see this week Energy and Commerce is going to do a markup of legislation, maybe tomorrow. I think it's tomorrow. And we'll see what ends up in that markup. It's above my pay grade, but I've been pushing for some of the things that, like this. The prior authorization is already a train that's left the station. We're waiting on a CBO report, which killed it last Congress. But I think we'll get there.
I want to talk about CDC. A lot of people, they took a lot of heat during the pandemic.
They did.
What did they do right? What did they do wrong? What do you think was fair? What do you think was justified?
Well, I think most of what they did was right. I think what happened is again, we talked about the politics of it. I think it was very politicized. I know Dr. Walensky pretty well. She was the previous CDC. I didn't know Dr. Redfield as well because he was there. We hadn't interacted much with the CDC until the pandemic, right?
Right.
We had, but not as much. And then Mandy Cohen, Dr. Cohen, who's current CDC director, I know very well. In fact, I was just in Aspen, Colorado at the Aspen Health Ideas Conference on a panel with Dr. Cohen. The thing that I think that that happened, it wasn't necessarily what the CDC itself got wrong, it's what the government got wrong.
In what way?
We politicized the CDC. We put political pressure on the leaders of the CDC to put out recommendations, from both sides, put out recommendations that would, in my view, would fit the narrative of where the political people wanted the discussion to go. Does that make sense? And I've told Dr. Walensky and Dr. Cohen both over the last number of years that one of my main things that we need to do is depoliticize the CDC. Now, how do you do that? Well, I'm personally in favor of doing something like you would as an FBI director, giving the CDC director a 10-year term with the possibility to renew versus having it flip every time the White House flips. You know, people in Washington are like, oh my God, you can't do that. That would be horrible. But I'm like, we have to depoliticize the CDC. I had legislation, let me tell you the political challenge of this. I had legislation, it's called HR 550, if anybody follows this. It passed out of, this is a couple years ago. Passed out, what it did, it was to help improve the CDC's data collection and cooperation with the states to make sure that we have good, solid data, right? And you can dig more into it. All you got to do is Google HR 550 and it will probably blow up. So what that did, it was something simple. Went through Energy and Commerce, voice vote, no challenges at all. Came to the House floor. A couple of people said it's a national COVID database. They're going to track you whether you have a vaccine or not. That went viral on the House floor. This does happen. Just watch the TV and you'll see. And all of a sudden, people started changing their votes to no. And we barely passed it, and then it died because of that.
Wow.
But that was completely false. That was reported in an online news organization, reported, I'm not going to say who. Completely false. They basically rescinded it the next day, but the damage had been done. That's the challenge of trying to depoliticize the CDC or the other health organizations because of this panic over Big Brother, really.
Sure. That's amazing. That's amazing. Was that on the suspension calendar? Like it was supposed to sail through?
Yes.
Or, yeah. Wow. Crazy.
And I was able to. I mean, I was on the floor, and I had to I talked to people and commit. Don't change your vote. Don't change your vote. And we ultimately still passed it, but barely.
But it hurt it. Yeah. One of my last questions is, I know you're retiring, but talk about healthcare in the next Congress. It's going to be a big tax year, but also a big healthcare year.
Yeah, I mean, the tax situation is going to dominate probably next year because of the expiring tax provisions. But in healthcare, the cost is too high. It's something is going to happen. There's so many areas in healthcare, and related to pharmaceutical prices, all kinds of prices. What the American people are finding is that even if you have health insurance, you still can't afford it.
Right.
If you talk to hospitals, some of the biggest accounts receivable they have out there, where they have an outstanding balance, are not the uninsured. They're the people with insurance that can't afford their copay or can't afford the piece that they owe because their insurance plan didn't cover as much as they thought it would. So I think that's what's going to drive healthcare in the next couple of years, is working on ways to get the cost down. And I'm hopeful that will happen. It's a complicated space to work in. Not many people on Capitol Hill want to touch it because it's politically difficult too.
Well, speaking of politically difficult, what about the future of healthcare, the future of Medicare? I mean, we're not on a good path right now.
I think it's promising. I think the future of the Medicare and the other programs is promising. I think we'll find a way to make sure that it's there for the American people.
But how are we going to do that? Because it's the solvency issue, and it's politically difficult. Both parties don't want to talk about, but eventually they're going to have to tackle it.
I think, it's very possible that when we actually do the right things, some people might lose their elections. I think that may end up happening, and people are going to have to be willing to do that. But also, I think what drives it is the American people. Mm-hmm. I mean, at the end of the day, when the political rhetoric goes away and the practical reality of what's happening hits, the American people are going to push their representatives on both sides of the aisle to do something to address it. People fundamentally understand that we have we have budget deficit spending. They understand that the health care is too expensive. Again, I'll get back to the expensive part. We have to get the overall cost down. And, we're always working on what coverage and how to pay the bill, but you can't pay bills that are too big. You got to get the bills down, and that's the angle I think people should take.
Well, Congressman, thanks for being a leader on healthcare, and appreciate you showing up. Please thank the Congressman for joining us.
Thank you.
Hey, thanks so much. That was great. Well done. Oh, well done.
Thank you. Thank you. Good to see you.
We've now come to the sponsor perspective portion of our program. Please welcome to the stage Deborah Melito, President of the American Society of Consultant Pharmacists, in conversation with Joe Ruffalo, General Manager of the Hill.
Good morning.
So the role of pharmacists in nursing homes and assisted living is unique. Pharmacists are empowered to assist medical teams in making sure medications are safe and effective, particularly for older adults or more sensitive.
I know, that's why I have some notes here.
Can you talk about your role in long-term care pharmacists and caring for patients and supporting their health goals?
Yeah, sure. So when we go into our nursing home facilities, as the senior care consultant pharmacists, we like to be part of the healthcare team. So we work very closely with the medical directors, the directors of nursing, the nursing home administrators, the infection preventionists, to name a few. And when we're part of that team, we are the drug experts, and we can really assist in that arena, looking at falls assessments, weight loss. We can look at different medications that may be contributing. And we also are very involved in the antibiotic stewardship programs at our nursing homes. I actually follow the CDC core elements for an effective antibiotic stewardship program, and it's a great educational tool that we utilize at a lot of our facilities. We also are very involved with all of the psychoactive medications that our residents may be on, specifically antipsychotics. And with the American Society of Consultant Pharmacists, we are very involved in Project Pause. We are actually talking with CMS about revisiting the way antipsychotics are listed, for each facility and how it affects their quality metrics and their star ratings. And then in line with today's topic, we really look at the CDC Advisory Committee of Immunization Practices, or ACIP, all of their guidelines for immunizations, making sure that we're giving the correct information at all times on the vaccines that our residents need.
So the responsibility to vaccinate was new to pharmacists in long-term care during the pandemic. Pharmacists actually provided over 80% of the vaccines in nursing home and achieved vaccine rates of over 90%. Since the pandemic, the rollback of flexibilities has hurt the rates of vaccinations. What can policymakers do to improve this going forward?
Yes, when we had those flexibilities through the PrEP Act, we were able, as a long-term care pharmacy, to order the vaccines, to store the vaccines, to distribute the vaccines, to administer the vaccines, and to bill for the vaccines. And that was very difficult to do when the vaccines first came out. I'm actually the vaccine coordinator for my pharmacy, and I found that it was one of the most difficult things I've done in my pharmacy career. However, when I was able to go into my nursing homes and actually immunize frail females in their beds, and they would look up at me and say, "Now my daughter can come visit me," that became I was so grateful for being able to do that. So we would really like to see those flexibilities reinstituted. It was the HHS secretary who let those flexibilities expire. So we would really like to see them reinstituted.
So the ECAPS legislation would empower pharmacists to test and treat for infectious diseases. How will this authority reduce the impact of outbreaks in facilities and save more lives in older adults?
So the ECAPS bill, HR 1770, I don't remember a lot of House bill numbers, but I remember that one. That actually could give pharmacists provider status, which is something that we've been trying to do for 50 years. It's in the Social Security Act where pharmacists have to be added as providers. So here's what happened during the pandemic. We were able to not only administer the vaccines and bill for them, but then we were given prescriptive authority to order nirmatrelvir or ritonavir, which is Paxlovid. So if a community member came into a community pharmacy, or like at my long-term care pharmacy, we would get orders from the nursing home where the doctors would say, "We need you to determine if this resident is a candidate for Paxlovid." And so, because I said earlier we're medication experts, we were able to evaluate the drug-drug interactions that can occur with Paxlovid, and we also had access to labs, such as the kidney or renal function, and specifically for Paxlovid, it's GFR. So if a resident needed to, tested positive for COVID, we would get the order to dose Paxlovid. So it would either be the standard dose Paxlovid, or if the GFR was lower, we would give the renal dose Paxlovid, or in some cases we would have to say, this resident is not a candidate for Paxlovid. Maybe we could try molnupiravir or Lagavria. So all things with COVID were not bad. We were given that prescriptive authority. And we would like to see that continue in House Bill 1770, in that we would be given the authority to test, treat, and immunize against 4 infectious diseases, namely flu, COVID, RSV, and strep.
Great. Is there anything else you think our audience should know today, based on what you've heard this morning?
So I liked what the congressman had to say. It sounded very positive, and if that bill would pass this week, that would be fantastic. I'm actually the president of ASCP, and I said maybe during my presidential year we will become providers. You know, I just think that we're in line for something like that. Like it's the right time. We proved ourselves during the pandemic. We had the highest percentage of immunizations in the seniors of anyone else. We were upwards of 80% and higher. And so when we were able to go in like on a consulting day and also immunize, it saved the nurses so much time. And we know that the staffing at nursing homes is not good right now. And so anything we can do to help the nurses, they really appreciate it. So having those flexibilities reinstituted where it can be a seamless process would be wonderful.
That's great. Well, thank you so much for your insights today, and thank you for what you do.
Thank you.
Thanks again to ASCP with support from Pfizer for their support of today's program. Now please welcome back Bob Cusack, joined by our panel of experts, Sue Peshin, President and CEO of Alliance for Aging Research, Rebecca Wingate, Vice President of Clinical Operations at PharMerica, and Jody E. Yeager, Director of Nursing Home Quality and Policy at Leading Age.
Well, thanks, and thanks for coming and being part of this panel. Why don't we just start off, I'm going to combine two questions, kind of explain your job in a few minutes, your passion for this issue, and what's the one thing you want people to take away from today? Sue, we'll start with you.
I love it.
Yeah.
Thank you. Hi, everybody. I'm Sue Peshin. I serve as President and CEO of the Alliance for Aging Research. And our mission is to change the narrative in aging for equitable access and improved healthy aging for all. And around vaccines, we want to make sure this fall everybody should get their updated flu and COVID-19 vaccines. Nobody's exempt. Go get them. And they're available, so please get them. We've been involved in issues around older adults and vaccines for a number of years, and really just want to try to raise the bar in getting to better rates of uptake.
Hi, Rebecca Wingate. In my role at PharMerica, we serve 400,000 residents and clients a day in 50 states. So we have a pretty big reach for vaccines with our 300 consultant pharmacists and 100 nurse consultants. And I'm very fortunate to be able to drive the vaccine initiative with remote and on-site clinics in these care settings. And really the message is what Sue just said, the access and the uptake. We've really seen a lot of misinformation out there, especially with social media, TikTok, Instagram. You know, once something goes viral, it just really takes off and gives, you know, just a bad taste in folks' mouth, especially when the news puts a headline out. I think the congressman said it the best. Once it gets out there, it's really hard the next day to take it back. So, thank you.
And I'm Jody Eager. I work for Leading Age. We are a not-for-profit association serving individuals, members across the aging services continuum. So we have members in the nursing home space where I work. We also serve home health, hospice, all the way down to affordable senior housing. We have PACE, adult day, life plan communities. We really span the whole gamut of aging services. And we're really, really dedicated, and our members are dedicated to ensuring that the older adults they serve and the staff working in their communities to serve these older adults are afforded the safest and highest quality environments to live and work.
Jody, just following up on that, COVID was a very intense time, especially for nursing homes, not only for residents, but also, as you mentioned, the workforce. Can you kind of say where the state of the industry is now as things have somewhat calmed down?
Exhausted.
Yeah, there you go.
It was an incredibly difficult time for everyone, right? It was an incredibly difficult time for the entire world, but especially for our healthcare workers. And it was pretty heartbreaking to hear what our nursing homes were going through, because here we had our dedicated healthcare workers who were going in every day, who sometimes weren't leaving, right? They were sleeping on the floors of their offices. They were staying in hotel rooms because they didn't want to go home and put their families at risk. Every day they were putting their lives on the line, day in and day out for years. And they were unfortunately kind of slammed in the media, regardless of all of the hard work and regardless of what they were doing. You know, they're going out there every single day, putting their lives on the line, and they're calling me up and they're saying, oh my gosh, we have another outbreak, and they're devastated to be losing the people that they have worked with and cared for years. And then they receive a box of supplies from the government, and it's cloth masks, when what we really needed was N95s. Or it's a box of 20 latex gloves, and they're all a size small, and who's going to be able to wear those? And so it was just a really, really difficult time, and yet they've continued to work and continued to work through that. And here we are, you know, 4 years later, and they're still showing up for work every day and still trying every day to put their best foot forward to make it a great place to live and work.
A quick follow-up on that, though. What were the lessons learned? Obviously, there were mistakes. It was something that hadn't come across in 100 years, but going forward, because who knows what's in the future?
Surely, yeah. So infection control, of course. We knew it before the pandemic that we really needed to focus on infection control. We needed to improve even the basics like hand hygiene, right? That's always one of the #1 tags for a nursing home is infection control, and hand hygiene's a major part of that. But we also learned things more systemically, like how our entire country needs to be better prepared for a pandemic and how our systems need to work together. So it's not just about the nursing homes being prepared, but it's about nursing homes and the greater health system being prepared, working together. It's about the greater health system being clued in and working with our emergency teams in our communities, those emergency teams working at the state level, working at the federal level, and having a better connection for preparedness and response and recovery from the top all the way down through.
Mm-hmm. Rebecca, you mentioned misinformation, and we're in an age now where a phrase that didn't exist many years ago, alternative facts, is out there. How do you combat misinformation? I mean, we've all talked to people who, you know, they believe things, whether it's about healthcare or anything else, without proof now, and that's a significant difference from where we were, I'd say, a decade or 15 years ago. What's the best strategy?
So pharmacists are so accessible, and during COVID, for example, I worked with a number of physicians where he had challenges with staff because they were just so fatigued with the information not understanding. They didn't know where to fact check. So we would give them resources on how to get this information or give them access to a pharmacist. In addition to that, when the physicians would approach us with not just their staff, but also the residents and family, we would ensure that we would give them websites where they could understand that they could just Google fact check instead of just Googling the information they were looking for, so that we could give them accessible resources, not just on the computer, but also accessible resources with pharmacists in their community or remotely. We talked about telehealth, I think, a few minutes ago with the congressman. I think that's definitely an important initiative to combat misinformation as well.
Sue, same kind of question to you.
Yeah, I would say we really need to get on the social media leaders, the heads of Google, YouTube, Facebook. We actually wrote a sign-on letter with dozens of organizations asking them to crack down on misinformation and disinformation much harder than they did during the pandemic. They make billions of dollars in advertising revenue. And there's been some studies to show it's about 12 different sources. So it's not even that many sources that pump the majority of misinformation that we see on vaccines onto social media. And this is something Congress really should take up.
Tell us, Sue, why immunizing seniors is so important, and tell us about, quote, our best shot campaign that you've been spearheading.
Absolutely, and when you talk about information, I think older adults can be great vehicles for spreading good information about vaccines, because a lot of older adults remember polio. And back then, people would stand in line to go get their vaccines. They couldn't wait to get their vaccines. It's really important that as we age, we make sure to keep up with our annual vaccinations or boosters that we might need, because our immune systems weaken as we age, just like our bodies weaken as we age. And also vaccines can weaken over time, which is why we need annual flu shots, and strains change as well from year to year, which is why we need an updated COVID-19 vaccine. So it's really important that also older adults oftentimes have other types of chronic illnesses that can put them at higher risk for serious infections, for hospitalization, and for death. And COVID-19 vaccines, in fact, reduce the risk of death about 97 times among older adults. This is according to the CDC. I was just looking it up. It's 97 times higher in those 65 and up than in those 18 to 29. So getting your COVID-19 vaccine, actually for people of all ages over the age of 6, is really important, because you don't want to spread it to people that you love. And that's the main point of these vaccines, is to reduce the risk of serious illness and death. You may still get COVID-19, you may still get the flu, but the point of the vaccines is to reduce the risk of serious disease and also after effects like long COVID. The COVID vaccines are according to CDC's data, very good at preventing long COVID.
Rebecca, can you talk about the long-term care challenges on reimbursements, specifically on vaccinating seniors?
Yes, absolutely. So with the challenge with COVID during the pandemic, we were able to go and vaccinate for both Medicare B and A. Unfortunately, after the PrEP Act and all that's gone away, we can't get reimbursed, the pharmacies cannot get reimbursed for those particular billing codes. So what we've had to do is be a little more creative in how we've established our clinics to capture that reimbursement.
And what do you think of the ECAPS legislation that the Congress?
Well, it's going to effectively fill a gap. We talked about staffing shortages. We talked about having on-site resources. Unfortunately, since COVID, the retail organizations and retail pharmacies are not able to go in on site to the communities, the assisted living communities and skilled nursing facilities, because they're limited capacity. They're closing down stores. And so really at PharMerica, we've been creative in finding solutions for these gaps to ensure we can use our staff to help with the staffing shortages and decrease the burden of getting the COVID shots and arms in the nursing homes. Because we know, I mean, once COVID gets into a facility, we saw the initiation of COVID out in Washington. It went from wildfire from Washington all the way to Chicago. So we're very sensitive to that. In fact, earlier we were talking about Paxlovid, I believe it was Deborah. Our dispensing rates for Paxlovid has quadrupled since May. So we are really seeing that uptick. And so you made a lot of great points about getting the shots, and I think we're seeing that in the communities. And I just want to mention, I just came from the third largest fair going on in the country called the Big E in Massachusetts. They expect 1 million fairgoers, about 90,000 per day. Janet Mikulski's here with me, one of our many partners at PharMerica to address the initiative for providing vaccines and access and administrations, and we have a tent set up there. We have a pharmacist leading the clinic every single day, and nurses and pharmacists administering it as well, because we know that pharmacists are not only the medication experts, they're the vaccine experts. They understand the storage, they understand the adverse reactions, the administration. So pharmacists really are your best opportunity to get the shots in arms safely and effectively.
And I mentioned earlier, Rebecca, the AMA has some opposition certainly to the bill, but have you, in your experience, found that people are comfortable with their pharmacists?
Oh, absolutely. I mean, at the Big E, I even had a surgeon commending us and thanking us, and so many healthcare workers, so many teachers, so many teenagers coming in with their grandparents and thanking us for vaccinating them to keep their grandparents safe, because they heard so many of their friends hearing about their grandparents passing away or getting sick and hospitalized.
Jody, I saw you nodding your head a lot, so I'll let you.
Yeah, I mean, we're not doing great with vaccination, right? The general public is not doing great. We're not doing great in nursing homes. One of the major reasons that a lot of people cite for their reluctance to accept a vaccine is trust. And so I know when we're talking about it with nursing homes, we have folks who have come into the nursing home for a short stay. So they've been there 3 days, right? They don't know these nurses. They don't know the medical director. Or maybe they've been living there for a few years, but they still have these longer term relationships with the rest of the healthcare system. They have a cardiologist they've been seeing for years. They have a pharmacist that they've been seeing for decades, right? And it's always the same. And so I think that's why it's so important then when we're talking about how to increase vaccination rates, we really need to look at a whole of the healthcare system approach. And we need to get absolutely everybody in the healthcare system talking with folks about why it's important to get a vaccine. And we need to increase access through things like the ECAPS bill, so that for the folks who are willing to accept a vaccine, there is no waiting. We've got the people there, we've got the vaccine there, we have eliminated the access and the barriers to make sure that folks who want the vaccine can get it.
Yeah, I just really want to appeal to the AMA and ask them to stand down on the ECAPS bill. It's needed. We have a workforce shortage across the healthcare workforce in the United States. We need pharmacists. I take care of my mom, she has dementia. The pharmacists are a godsend to me. I manage my mom's medications. I organize them every week on Sunday for the whole week. It's over 10 medications. And they have saved me multiple times from, possibly running out of a prescription, last minute, to how do things interact with each other, to not remembering, is this supposed to be morning or evening? They're there, and they know, and they remind me about when my mom needs to get her vaccines. And they ask about my mom, and I see them more often than we get to see the doctor. ECAPS is not a threat to physicians. The pharmacists always tell me when it's out of their scope and I have to go ask the doctor something. We need this legislation. Over 200 organizations, including mine, support it. AMA, come on, join in.
Are you optimistic that it can pass before the end of the year?
Sure, it should, yeah. we need AMA and we need the will of Congress, but we can make it happen.
You mentioned the workforce, and Jody, maybe we'll go to you on this. As you mentioned in detail, healthcare workers were heroes during the pandemic, but we do have a healthcare shortage, as Sue mentioned. My 3 kids are playing their part. They want to go into healthcare, have no interest in journalism. They're smarter than I am. But that's a major problem. We're talking about taking care of parents, and that's something they don't teach you in school. It's rough. It's very difficult. But our society is aging. What are the challenges there?
Well, I think you hit the nail on the head there. I think that society has a major issue with aging. I think society has a major issue with mortality. And that is why it is so hard, one of the reasons that it's so hard to attract people into aging services, is because we are terrified of what it means when we're staring aging in the face, right? What does this mean about me? What does this mean for my future, or for my parents, for my loved ones? And so I think that we really have to combat that on a daily basis. We need to work as a nation to come up with a better plan to support aging services. Part of that is going to be funding, right? We really need to invest in what's important to us. And if we're saying that older adults are important and that we want the latter halves of our lives to be rich and to be fulfilling and to be satisfying and to be healthy and to be safe and to have a quality of life and a quality of care, then we really need to invest in that. We need to put our money where our mouths are.
Rebecca, same question to you.
Yeah, so I mean, we know it's a fact. There's 10,000 folks turning 65 in this country every single day. And fortunately, the company I work for, Pharmerica, we took on a challenge to find solutions this vaccine season, and we're going into over 300 assisted living communities and IDD group homes, intellectually developmentally disabled, to do over 300 vaccine clinics on site. This is to the tune of about 40,000 vaccinations, because we need a solution, and ECAPS will fill that gap, and hopefully we have some listening ears today.
I want to get each of your takes on what the congressman said about the concern about vaccines regarding COVID has spread to other vaccines, childhood vaccines, the flu vaccine. I think at this point there are some people that unfortunately are just not going to be convinced on any vaccine right now. But how do you convince the people who got the vaccine, thought they wouldn't get COVID, got COVID? I mean, that happened to many people, happened to me, but it was very reassuring because COVID was not a fun experience for me that I wasn't going to die. But that said, there's this doubt now that is in society with very reasonable people who are still, I don't know if I'm going to get the COVID booster. I don't know if I'm going to get the flu shot. How do we, Stu, we'll go to you first. How do you deal with that? How do you combat that?
Yeah, I mean, you have to take time, and you have to listen to people, and you can't be judgy, right? We're so judgy now about everything. People have been exposed to a lot of stuff on the internet, and they hear things from friends and all of that. So you have to hear people's questions and have time to have conversations, and that's one of the reasons why I think when you go into long-term care facilities, there should be universal accessibility to vaccines. I mean, even the staff in long-term care have higher rates of vaccination than the general public, but part of what we have going on is there's so much negativity towards long-term care, which feeds into negativity towards aging and how we treat each other. So, you know, in terms of teaching people about vaccination, we have to get more of a sense of community back again. Not just taking care of ourselves or just our immediate family, but community and what that means. And to just take care of each other by keeping each other safe and making it available at your state fair, at fun places, you know, to go. So the more accessible, the more likely you are to get it. You can talk people till they're blue, but if you don't have shots immediately available to give them, they're not necessarily going to say, all right, I'll do this tomorrow, I'll do it next week. You have to have the shots right there.
Yeah, and it's, you know, Mitch McConnell, who recovered from polio as a child, was stunned that, because as we all, well, most of us remember that it was a rush to get the vaccine. It was historic pace for this vaccine. And yet what he said he was stunned by is that some people wouldn't get it. So important for everybody to weigh in here. Rebecca, you know.
Oh, well, absolutely. And you know, I think the misinformation of a vaccine is a cure, it's a prevention. And really, I think what people misunderstand is they're going to get this shot in their arm and they're not going to get COVID, they're not going to get flu, and they don't understand they're not getting the counseling that's so needed when they get that shot in their arm to understand the adverse events that they might experience. So they get a flu shot, the next day they get a fever and they associate, I'm always going to get a fever when I get the flu shot. Or they had a friend who had a bad experience with the COVID shot, so then they're like, well, I'm not going to get the COVID shot. But then there's others on the other side of that who have experienced those very sad stories of losing loved ones, losing friends that did not get the COVID shot. They got the COVID shot, and then there was guilt for them getting the shot. I'll tell you, I sat across from 1,000 folks this past 4 days, and there would be a couple sitting side by side, and the wife is like, I'm not getting it. And the husband's like, please, please. And I just said, well, you know, I'm not going to pressure you. You know, your husband loves you. He wants to keep you safe. Do you have children at home? Oh, you do? Oh, they just started school? Oh, okay. Well, you're protecting your children by getting the shot. And I would just state the facts. Oh, your children have grandparents. So just the counseling and the human, you know, relationship. And I'll tell you what, every time it worked. I said no pressure. Every time it worked, then they would get the flu shot and the COVID shot.
A quick follow-up there, but like I'm interested in just what you took away from the 1,000 people. What's the mood? What are the questions the trends that you saw?
is this the newest COVID shot? So they don't understand that we don't use vaccine from the previous year. They think we're just holding in a fridge somewhere and it's not going to be good for the strain. You know, and like what strains are this good for, like the flu, and just a lot of people just coming up and asking questions. They already had their shots and they come up and ask questions. I give them a vaccine information sheet or the VSafe website or the VARS information. So just a lot of counseling. I was very surprised. There's a lot of questions out there in the communities.
Let me go to Jody first and then go back to Sue.
Yeah, I think it's I think it's about what the congressman said several times. I think it's about normalizing it. Some of the messaging is the same, right? It's not about you. Yeah, you're getting vaccinated to protect yourself, but guess what? You're actually getting vaccinated to protect everybody else. We all need to pull together. You may not want this vaccine, but think about those around you, right? But I think the other part of it, and where I'm hearing from our healthcare workers, where the challenge is there, is that we have this message that we have been putting out since the beginning of the pandemic about COVID will kill you, COVID will cause you to go to the hospital, it's a very terrible, terrible illness. If you get vaccine, you will be protected from severe illness, hospitalization, and death. All of those things are true, right? It can kill you. Vaccine can help save lives. But the trouble that we're running up against is that the message that we could putting out, especially when we're talking about these really terrible worst case scenarios, it doesn't ring true to the people that we're talking with because that's not their lived experience, right? We have a lot of healthcare workers who are out there saying, I hear what you're saying, but I see all these residents in the nursing home and they're getting mild illness. Or I have friends out in the community who didn't get vaccinated at all and they're not getting COVID, or they're getting COVID and it's mild illness. And so that's where the trouble comes in. And so I think that we need to get back on this normal side, like the congressman was saying, where we're telling people, this is what you do. You get your flu vaccine every year, you get your COVID vaccine every year. It protects society and we all move forward and we're able to do things like HHS's campaign, right? Risk less, do more. Let's get back to our lives. And the way that we do that is by making this a normal part of that.
Yeah, and I just wanted to add two really good resources. One is a coalition that we co-convene with Healthy Women and the National Caucus and Council on Black Aging. It's called Champions for Vaccine Education, Equity, and Progress. And the website is super simple. It's cveep.org, cveep.org. And then the other one is vaccines.gov, and that's where you can find out where to get your vaccines. And we actually link to that on the cveep.org website. We have a lot of different fact sheets you can use when you're talking to your loved ones, and please come visit us and join.
Last question, Jody, start with you, go down the line, about maybe 30, 45 seconds each. What do you want policymakers to stress in the upcoming years? What frustrates you most about DC politicians?
Oh. Am I allowed to answer that question? No, I think the most important thing is working together. I mean, we all have the same goals, right? We all want to live in a place that is safe and thriving, and we can all live happy, healthy lives and be shiny, happy people, right? But to do that, we have to work together. And yes, there are some things that we disagree on, but there's also a lot of things that we agree on, and we just need to find what those are. We need to come together. And you know, I don't really have a taste for politics. I've never been involved in politics. I'm a social worker. And so I don't understand necessarily the chess game and holding things hostage for other things. Like, let's just get the job done.
Well, and for me, I work with a lot of physicians, and we work with the interdisciplinary team together. So we know it takes a village. It's not just the doctor with the power of the pen. He's asking my opinion, he's asking psych's opinion, social worker's opinion, physical therapy, he or she, excuse me. And we know that it takes a team. If we're just going to rely on one person at the top, I think we need to understand that everybody's going to stay in their lane. They're going to do their scope of practice. They trust that they know that they can lean on their IDT folks, whoever that may be in the room, or pick up the phone to get that resource to ensure that we're taking the best care of this patient with their patient-centered care, what we call long-term care. But really, specific to long-term care, we really see a lot of need for this interdisciplinary approach. And it's really gaining legs, especially with the physicians, because they're so limited. Now there's nurse practitioners, there's physician assistants, and they have limited scope sometimes with their ability with the medications, and they come to the medication experts, the pharmacists. So I hope that everyone hears that message, that is part of the voting for this, and that we can move forward. And Jody, I think you said it best. I mean, just working together.
Yeah.
So we'll give you the last word.
Yeah, thank you. I would just say, Congress, please pass that ECAPS bill, and also encourage the Centers for Medicare and Medicaid Services to fix the issues with vaccine reimbursement and coverage in long-term care.
Well, this has been a great panel that's focused on real facts, not alternative facts. Please thank the panel.
Well stated. That was great.
Thanks so much. Thanks so much.
Please welcome our final speaker this morning, Dr. Meg Sullivan, Counselor to the Secretary at the Department of Health and Human Services.
Hi, thanks for joining us.
Thank you for having me.
Okay, let's start with maybe a PSA of what people should do this fall.
Yeah, and so good morning, everyone. First, thank you for having me. I am Meg Sullivan. I'm a pediatrician by training, but currently work as a counselor to the Secretary, Javier Becerra, including covering COVID-19. And I'm really excited to have this opportunity. Although there was a moment where I was thinking I didn't need to be here because I felt like the other panelists were doing my job. So yeah, my PSA is risk less, do more, which you already heard about. You know, I think we are entering the fall respiratory season. You know, obviously this is a time where we know people get sick, we know people are hospitalized, and unfortunately we know people still die, but we also know we are so much more prepared at this time, and we have effective vaccines. And you know, so I think more than anything, everybody should be vaccinated, everybody should tell their loved ones to get vaccinated, and everybody should take all of the measures to protect themselves and their loved ones.
I know you described a little bit of what you do at HHS, but can you kind of expand a little bit day to day, what's your role, and maybe working with other agencies and educating the public, et cetera, et cetera?
Yeah, I think specifically, right, with COVID-19 and more broadly respiratory season, you know, HHS obviously as the kind of federal agency that helps lead responses as well as make sure that the public has the information and tools it needs to protect itself and prepare for respiratory seasons. You know, I work across a variety of agencies, whether it's the, you know, scientists at FDA and NIH, whether it's, you know, public health specialists at CDC and the Office of the Assistant Secretary for Health, whether it's actual providers through Indian Health Service who are on the ground providing it, whether it's through HRSA, you know, who are working closely with our community health centers that we know are so fundamental to making sure that we are accessing rural areas and other places that don't necessarily always have access to health care. And I think, you know, in the Secretary's office, our role is really to make sure that, A, we have kind of a coordinated response, messages and tools that speak to people and reach people. But I think more than that, and one of the reasons that I'm here today is partnerships, right? We, you know, the collaboration that is so necessary with our federal, state, and local partners. Without that, all of the work that we did would never kind of see where it needs to go on the ground. And so that's part of my role as well, is to help coordinate.
You know, as a newsman, everyone has a story. You joined HHS in 2021, a historic time in health policy making. Can you describe the experience and experiences that you went through? I'm sure it was intense, and what can we learn from that time period?
Yeah, I actually spent the very initial part of the COVID pandemic working as the medical director of a health department in North Carolina, and then, as you mentioned, joined HHS in December of 2021, just as Omicron was coming into our country, and at that time was working as the chief medical officer for the Administration for Strategic Preparedness and Response before I went to the Secretary's office. And I think the amount, I had seen from the ground just how much work was being done, but to see it firsthand and to experience just how difficult it was. In particular, you know, ASPR at the time, we were still distributing vaccines, you know, tests. This was when kind of COVIDtest.gov was just launched. but yet there weren't that many at-home tests. And so working to see how we could get them and get them into the homes of people. Therapeutics were just coming into being authorized by the FDA, and so working on supply and how we make sure that we do that as well. I can say, and I really do mean this honestly, the thing that struck me more than anything else was that equity was literally at the center of every single conversation. And again, we had millions of vaccines, millions of tests, soon to be millions of therapeutics as supply went up. But we recognized it was not just about distributing them, but really getting them to where they needed to be. And again, I will hesitate to sound like a broken record here, but without the partnerships that we formed to be able to do that, that would never have happened. But I think I'm really proud of the work that I've seen HHS and my colleagues do. But again, it was through that partnership and with that never-ending focus on equity.
Every speaker today has talked about the next question, but it's an important one. I want to ask you, how do you combat vaccine distrust and fatigue?
Yeah, I think it is such a hard question, but important question, right? Kind of as a pediatrician, I obviously have spent so much time talking with parents and patients about the importance of getting vaccines. And I think sometimes it is hard, to be where we are right now to see just the level of distrust and misinformation that is out there. I think, and I may echo a little bit of what I heard the previous panelists say, but I think the first thing is to be open to having those honest conversations and to recognize that there are valid reasons that people may have questions about the vaccine, whether it is something that they read, whether it is an experience, right, that they have had or that a loved one has had, whether it is just not having the right information. And so I think having those conversations and really trying to pinpoint for each person what it is that is making them question what the vaccine is. I do think the second thing, and and I heard this said before, but I think one of the things that we have been trying to work through, whether it's the CDC simplifying the respiratory season guidance or the HHS Risk Less, Do More campaign, to really go with those simple messages, really try and get at what the heart of the matter is, right? Respiratory season is coming. Vaccines are safe. Vaccines are effective. Vaccines save lives. Let's do it. I think the third thing that we are really trying to do, and that the Risk Less, Do More campaign has been doing, is really doing focus groups on the ground with individuals with lived experiences, but also, importantly, healthcare providers and healthcare navigators and those that are actually out there, right, talking with individuals who may have those campaigns. And that's where a lot of these messages are being formed. They're continuing to do that research to inform, every step of the campaign that we'll see over as the season continues. And I think that's something that is really fundamental and going to hopefully make a big difference.
I've seen some figures that as far as the flu vaccine, it's right around 50% right now. Has COVID affected the flu vaccine as far as rates?
Has COVID affected, so maybe...
Meaning the concern about COVID that's out there lowered.
I see, you're talking about vaccine uptake.
Uptake.
Got it, okay.
Yeah.
I think that if we look at kind of pre-pandemic vaccination levels across the board to kind of where we are right now, whether it's a flu vaccine or others, I know we definitely have seen a bit of a drop. I think there's many things that we could point to. I think we've talked about vaccine misinformation, and a lot of that kind of came probably, even more prominent during the pandemic, which obviously would be influenced by COVID. So I don't think we can pinpoint one single thing,
okay.
But I think the most important thing, right, is to recognize where we are right now and what we need to do to hopefully get back to those levels that we've seen before.
And a lot of people, I remember about 10 years ago, I was too busy and I didn't get the flu vaccine update, and then I got the flu. And I learned from that lesson. I have a friend who 50 plus, didn't get the shingles vaccine. He's got shingles now. It's not a fun experience. Mm-hmm. But what are the most convincing arguments other than, oh, well, now I have it, I should have gotten it, but because not everyone's going to be in that camp.
Yeah, and I think we have been trying to, again, through this Risk Less, Do More campaign, try and pinpoint what those arguments are, right? And, really honing in on just a couple. I think the first is really about the level of risk, right? And I think, first of all, the campaign is tailored towards those that are at highest risk. And, when we're talking about COVID, obviously individuals over the age of 65, those that live in long-term care facilities, those with significant underlying conditions. But I think what's important to recognize is that nobody has a risk of zero. And so every single person, right, getting a vaccine decreases your risk even more. And I think just to recognize that. I think the second is, really that message around the protection of loved ones, and to recognize, even if, again, you may not fall into a high-risk category, someone that you are around, that you may live with, that you spend time with does, and really the role of doing that. And I think third, it really is, just about, again, understanding kind of what the recommendations are, what the safety, data shows, and just that, again, risk less, do more, that really just getting that vaccine really allows you to do more fun things with your life that, we weren't able to do a couple of years ago.
What are other than the mistrust and misinformation that's out there, what are the biggest barriers to vaccinate specifically older Americans?
Yeah, I think that it's conversations that we are having every day about, right, we can have all of the vaccine supply that we need in this country, but if it is not where it needs to be, when it needs to be there, then that is a barrier. And so I think that is why, it is so important to make sure that vaccine is, kind of accessible around the country. But I think in particular the focus, and this is what the campaign is doing too, on long-term care facilities, recognizing the additional risk. And so I think that's something we have been working very closely with our long-term care partners. We have seen such incredible best practices and things that work, and thinking about how can we take those and apply those to other institutions. I think insurance coverage is another issue. I think making sure that everybody recognizes that, for Medicare now, that vaccines are fully covered. And so that people, when they do go get vaccinated, should have no, that are on Medicare should have no copay, and really trying to get that message out.
So cost is a major concern for people.
I think, I think for certain people, right?
Certain
so
people,
I think,
course,
yes. So really working on that, working on access. And then again, I think it is thinking about, right, what would be reasons in particular when we're thinking about older adults that they may not get vaccinated, and as we think about our messages, to tailor it there.
As I was talking to the congressman, we talked about the possibility of a shutdown during this time when we're talking about vaccines and the import of getting them. What would a shutdown do to this space?
Yeah, I think vaccines are in the commercial market right now. And so, I know that's something that HHS worked hard to do and our partners worked hard to do. So in particular around vaccine access in the commercial market, well, it's hard to know what a shutdown would do with anything, right? But I don't know immediate. But I just think what more importantly, I think it's important to recognize just all of the important work that is happening, and hopefully that we can continue to do it without any delay.
What would you like to see Congress do moving forward to further these goals?
Yeah, I am also, I know you asked a question about a DC politician. I consider myself not that, but I will. I'm obviously always careful when I'm talking, but I do think that idea of, working together, I think we have done a lot over the last 4 years around pandemic preparedness, and I think I've often heard some of my colleagues say, the next pandemic is not if, but when. And so I think taking the lessons that we have learned over the last 4 years, the capacity and the tools that we have built, and making sure that kind of the government is resourced to not only continue those, but expand upon those, so that the next time we are faced in this situation, we are even more prepared than we are now. And even, fortunately right now, we are not in a pandemic situation, but to just make sure that we have the resources we need to be able to reach and help the people that we need to, including during this respiratory season.
A lot of people are getting COVID. I'm sure a lot of people in the audience, there's an uptick. Is that alarming to you, or is that just the way of the world right now?
Yeah, so I think we obviously were watching. We know particularly during August, the COVID, we saw a big increase in COVID infections. COVID rates do remain elevated in the country, although we are seeing generally a decrease. However, it is now September, we're going into October, November, December, and fully expect to see not only those rates potentially begin to increase, but also we have flu and RSV in the horizon as well. COVID is with us. I think it is endemic, just as flu and RSV are. So, I think alarming may not be the right word, but I think acknowledging it and being prepared for it. And again, at the risk of sounding like a broken record, let's use the tools that we have, right? Let's get vaccinated. People are sick. We have effective treatment, so let's use tests, right? Test early, access treatment. And I think that if we really do those things, then it becomes a lot less alarming.
I wanted to pick your brain a little bit just on the effect of COVID, because America is very focused on America, but the pandemic was global. And it's interesting to see different pockets of the world doing differently. And it was just, and I think to the defense of public health officials, I mean, this was something that we haven't seen in 100 years. It was weird, as some people were asymptomatic. Obviously, a lot of people died. I mean, so this was not easy to get a handle on, especially when China's not giving the world information. But looking, what have you learned from the global effect, and are we going to be learning a lot over the next maybe 5 to 10 years? Because there's still questions we don't know.
Yeah, I mean, so I think first of all, and I think we've seen pandemics and infections in the past that have been global, but I think COVID just highlighted, right? We live in a global society. And so, I think our pandemic preparedness, for example, cannot just be focused on domestic, but needs to be focused on global preparedness. And that is a lot of work and focus that HHS has done. I think that those strong partnerships around the world are so incredibly important. We do have employees of HHS that are constantly, whether stationed around the world or working around the world, I think is incredibly important. I do think learning from each other. I saw a lot of that during my time here at HHS, right? Particularly, as we were still rapidly evolving information, and we were looking at some of our partners around the world who maybe saw some of the new strain peaks earlier and what they were learning in terms of vaccine effectiveness or testing. And so I think all of those lessons learned are things that we have to continue to apply and make sure is a focus as we continue to focus on preparedness.
You mentioned, and we talked about a lot today, aging society, the import for older Americans to get vaccinations, especially as a country, we're aging. What keeps you up at night, and kind of a closing, what do you want people to remember from what you want to say today? And the one thing, I always say with one article, our reporters, if they remember one thing from your story, that's a great thing. What's the one thing you want people to remember?
Yeah, well, so there's a lot of things that keep me up at night, so I won't answer that question. But, this is going to sound cliche, but I think the reason I am here, right, is to say the one thing is everybody should get vaccinated, should tell their loved ones to get vaccinated, they should encourage others, they should, I will just give again a plug for our Risk Less, Do More campaign. The website, risklessdomore.hhs.gov, has so much information. There's also a contact us place where if individuals are interested in reaching out and partnering and learning more. I think, we have a fall respiratory season coming, and we have the tools to help minimize the impact that we will have for ourselves and our loved ones. And I think the thing to remember is we just need to take advantage of those tools.
I think that's good advice. There's been a lot of good advice today. Please thank Dr. Sullivan for joining us.
Thank you.
Thank you so much.
Thank you.
I'll hand it over to Joe.
Thank you, Dr. Sullivan and Bob. I'd like to just thank all of our amazing speakers today. I feel like I should have one sleeve rolled up at the end of this. I'd also like to thank our sponsor, ASCP, as well as support from Pfizer. I'd like to thank all of you for coming. If you missed any portion of this, you can find the whole video and background at the Hill. Stay well, and thank you again.